This month is Women's Health Month, and in the past few years, we've actually seen an alarming trend when it comes to alcohol. A report from the CDC shows alcohol-related deaths are up nearly 15% over the last 2 decades. So to walk us through what's behind this trend and steps toward turning it around, we have Dr. Saul, the Chief Medical Officer of Women's Health at United Healthcare. Thank you so much for joining us.
Thanks for having me.
So those numbers obviously alarming. We know many health issues related to alcoholism, but what are some of the concerns specific to us women?
Well, for women, I think it's important. I'm so glad that we're talking about this too, by the way, because it's an important part of the fabric of our society is alcohol use, and we don't often talk about it. And so it's easy to sort of overlook what some of the risks of alcohol use are. And so for women, it's important to know that women absorb alcohol more quickly and they metabolize it slower. So it hangs around in our body a little bit more than it does for men and can lead to some significant health outcomes. Our former Surgeon General has called out the fact that alcohol is related to many cancers, breast cancer, colon cancer, and so it's important for people to know that their alcohol use can cause some concerns.
Let's talk about how can someone define their relationship with alcohol? When is it going too far? You know, you're going out with friends, going on a wine tour with your girlfriends. How far is too far when it comes to alcohol?
Well, for women, what we would call binge drinking is drinking more than 4 beverages in a 2 to 3 hour period, or drinking more than 8 alcoholic beverages in the course of a week. So that's what we would consider heavy drinking. Certainly any other routine drinking, daily drinking that you must do would also be cause for concern.
So when women go to their doctors, what are doctors looking for? Because I feel like a lot of women might not say, I'm a binge drinker, I drink more, you know, when they can lie on the little thing, how many drinks do you have in a weekend? What are you guys looking for?
We ask questions that spell the letter CAGE. So do people have a concern about the amount of alcohol that they're drinking? Are they getting annoyed by anyone that's pointing out how much they're drinking? Do they feel any sort of guilt about how much they're drinking? And do they need it just to get going? Do they need it for an eye opener? Do they need it just to get going in the morning? Those are some of the things that you can kind of click through and get a sense. Doctors can do that, but people themselves can kind of go through that screening as well.
And if people are thinking, okay, that registers for me or registers for someone I know and love, how can they help?
Well, I think it's important, as you mentioned, to have a conversation with your doctor for people who have any sort of supportive services through their employer, like an employer assistance program that can help with counseling. But even beyond that, I think it's just the awareness. So the awareness that this can be an issue is really important for women so that we can start to think about it, plan for it. This is the season of graduations and weddings and celebrations where alcohol is going to be running wide open. And I think you have to sort of plan and think about, how much am I going to drink? What am I going to drink? Are there any non-alcoholic options that I can be thinking about that are equally as festive, that sort of help temper the amount of alcohol
As
that's
a pregnant
being
woman,
used?
there's plenty of non-alcoholic options that are fine out there. Yes. Dr. Saul, thank you so much for the time on this important issue. Really appreciate it.
Thanks for having me.